Hi, I'm Dr. Angela Flores. I'm an assistant professor here at Paul L. Foster School of Medicine and a neonatologist at El Paso Children's Hospital, and I'm a specialist. My specialty is neonatal-perinatal medicine, and we basically take care of newborn babies, whether they're premature or term babies, if they have certain problems like congenital anomalies or any problems with transitioning from at birth is what we do. We take care of these kids. I had a very good mentor when I did my pediatrics residency back home in the Philippines. But along with that, I met a mom that I used to take care of her son in the NICU back home. And it was interesting that as the baby got older and was following with us in the outpatient clinic, she would constantly look for me, and I ended up taking care of this baby up to the time that I left to come here for my pediatric residency, and by then that baby was about 3 or 4 years old. When parents begin to trust you and trust that you'll take good care of their children, it's the satisfaction that is never quantified, not even financially. And I like taking care of kids, especially the most vulnerable population of pediatrics, and these are your preemie babies or newborn babies. Just seeing them grow from tiny one to finally a toddler, or even I think the oldest one I've taken care is probably now 8 to 10 years old, and just seeing them grow and grow normally is quite rewarding. Here, especially in Texas Tech, I think one of the good things about the Division of Neonatology here is that we have a high-risk clinic where we follow up our graduates. Not every program has that, so we follow them up to age 3 and making sure that they're developing well. I think it's quite an asset. Just imagine taking care of a 750-gram baby, which is about this size, and seeing that baby grow over the months, years even. To me, that one's the most rewarding thing about this specialty. They're very vulnerable and fragile. Pretty much they leave it up to you to take care of them. And when you do the best that you can with the technology that you have around these days, it's an amazing thing. The academic institutions or the medical school constantly reminds you what it is like to be a student. That thirst to learn. And that sort of kind of bridges theory with reality of being in a children's hospital, where you see what it is like to be as a child with some condition and some illness. You're teaching medical students, but you're also learning along with them, because the medical field is growing. I mean, with technology out there, there's always something new. I mean, what I learned 20 years ago is not what we're practicing now. And being an academic institution, you have to be abreast with what's new out there. Children's hospital in this region is a need. If you look at Texas as a state, there's nothing around this area. I come from Houston, where we had the medical center, and Dallas is not far away, San Antonio, Austin. But in this part of Texas, there's no children's hospital at all. So I think it was very timely to have El Paso Children's Hospital. Having started working here in El Paso Children's, I'm really amazed at the facility that they've given us. I mean, this is a wonderful NICU, both a level 2 and a level 3 type of NICU. And I've worked with several families here, and just the trust, I think the trust that they give you is, you don't always see that. It's almost like you are our doctor, do what you can for our baby, that sort of trust. I've worked in the bigger cities, and that's something that you miss when you work there. I think in little cities like El Paso, the respect that they have for their physician is amazing. truly amazing. One of the biggest advantage of having a children's hospital like El Paso Children's is having all the specialties in pediatrics around if you need them. As we all know, kids are not adults and they have different needs, and you need to have somebody, a physician that is specialized or trained in taking care of these children. Having the School of Medicine, the Paul L. Foster School of Medicine, is even an additional advantage because you have students rotating with you. You have the research center nearby who's constantly looking for ways to find cure or answers to our questions. So there's that, like I said, a bridge of theory and reality, and keeping yourself in the loop, what's out there, what's new as far as medicine is concerned.